2/3 of your blood volume at any given time are in your veins. Now it's not just pooled there, right? It's flowing, but it's kind of flowing sluggishly. And we can alter this massively. When we constrict some organs, when we constrict our muscles, it pushes on that, it increases venous return, and that increases preload, and that's what makes cardiac output go up immediately. We talked about that before. All right, arteries, look at that by comparison. Arteries, only a quarter of the amount of blood that the veins have in them. About 15% of our total blood supply. Over here, the heart, I think I tried to remember, somebody asked me, I said 7 or 8, so it's pretty close. 8% is about what's in the heart at any given time. Capillaries, not much. Right? Only 5% of your blood volume is in the capillaries. However, this is the 5% that's actually doing nutrient exchange. Everything else is not. Okay? The blood is flowing very slowly through the capillaries, so it has time to do exchange. And then lastly, in the pulmonary circuit in your lungs, you've got another large amount. You've got about 12%. So, of these numbers, what do I expect you to remember? Well, definitely I want you to remember that 60% for the veins, because that's significant for preload. The other ones, I'm pretty comfortable if you just remember the relative amounts, okay? For instance, arteries, lungs, heart, similar. They're pretty similar, okay? And the capillaries being the smallest amount. Okay, veins. Well, we know veins are kind of wimpy. They have a decreased tunica media, so that makes them weak, and we know they can collapse pretty easily. Here are some descriptions for you. There's our capillary, down to the diameter of 9 micrometers. I think I mentioned you can even have capillary down to say maybe 5 micrometers. That's really small. The diameter of a red blood cell, for instance, is about 10 micrometers. Did I mention this before? So sometimes you can have capillaries smaller than red blood cells. So for red blood cells to get through those, they actually got to fold in half and slip through. All right, then we got venules. So here we have venules again, below 1 millimeter typically. And then up there we got a large vein. This is a big vein. Look at that. That's 5 millimeters. Those veins can go all the way up to a centimeter or more, I think. No, they don't continue off the chart. So you can have a large vein all the way up to the diameter of a centimeter, or even a little over that. 2.5 centimeters for your vena cava. There's a picture. We've looked at that at a lab, so I don't really have to elaborate on that. Okay. Artery, vein, and you look at that marked difference in the tunica media. We know what anastomus is already. Yeah. Just trying to get my thoughts in order. They go in a little illogical order. So I jumped ahead a little bit just to show you another picture of a vein. This is one of the deep veins of the leg in here. And they're showing you some skeletal muscle squeezing on it. So they're showing you the purpose of those veins, the endothelial flap valves in the veins, especially in the lower legs. You get blood down to your toes, and it's only in the venous side circulation at a pressure of maybe 10 millimeters of mercury. That's not going to be enough to push that blood all the way back to the heart. So you have to have some help. And I think I mentioned this before. There are 3 things that help. One, the valves. So during systole, the pressure bounces up a little bit, and we push the blood forward, and then it would sag backwards, so the valves keep it from doing that. Another thing is, when the muscles press on it, the blood can't go backwards, so it goes forward. So you're assisted by your skeletal muscle pumps. They push on the veins and help push the blood back. And the third thing is when we breathe. Okay? When we breathe in, we increase a negative pressure in the thorax. So that's like sucking on a straw. When we do that kind of thing, the pressure in the thorax drops, and that helps draw the blood back. So you got these 3 assists to bring the blood back. Okay? So they're just showing you the valves. You have a lot more valves in the lower limbs, and we were looking at, somebody was showing me a question in the lab book where it was talking about refill time of the veins in the hand. And actually it was in your lecture book, and I'd never seen that before. It's an idea where you leave your hand down like this for a little bit, and the blood starts to collect down there. You can see the veins in your hand, the superficial veins start to pop out a little bit. So evidently, you can try to take your 2 fingers and squish the blood out of one of those, which I can't do very well. Right? And then when you take the top finger off, you can see if it refills. And if it stays sucked down a little bit, then that means the valves are working pretty well. And if it plumps back out immediately like mine did, that means the valves in your hand aren't working very well. So I guess I'm screwed. That's the idea. I never tried to do that on a hand before, and that makes more sense to me on the feet and the legs. It's going to be fraught with a few problems because you've got collaterals in there. So if you don't block those off, the blood just goes back to the collateral. So I don't know. I'd have to talk to somebody that works at a vein clinic and is better that to really understand the best way to do that test, because I couldn't get it to really work. But that's trying to assess the integrity of the valves. No, so there's the respiratory pump and the muscular pump I just talked about. Now let's back up here again. Back to this picture of the vein. And I know it's in the slide set somewhere, I just couldn't find the term. Because veins are a little bit weaker than our arteries, they stretch more easily. Veins stretch more easily than do arteries. We call that concept compliancy. Okay? When a vessel stretches easily, it's called compliant. And if you think about this, this explains why we have problems with arteries as we age. Now we're talking about veins here, but let's jump over to arteries for a sec. Think about, nothing to write down here, I just want you to listen. The aorta is an example of one of those conducting arteries, right? It's elastic. So it has to be able to push on the blood. Well, it also has to stretch fairly easily when we inject blood. So the artery, the aorta has to balance between being fairly compliant and being able to stretch, but being able to push back. So it has to be nice and elastic too. As we age, our blood pressure goes up and the aorta becomes more fibrotic and it loses that elasticity. So it becomes harder for it to stretch. And that sets up a positive feedback. So as our blood pressure goes up, generally it makes the aorta work a little harder, which makes it become more fibrotic, which now means the heart has to push harder against it to stretch it. And over time, this is what exacerbates your increases in blood pressure. Being elastic is kind of the opposite of being extensible or stretchable. So the aorta has to walk that fine line between trying to be compliant, stretch, and yet elastic. Now veins don't have that problem. Veins can stretch all they want. They barely have to push back at all, which is why our venous side blood pressure is so much lower than our artery side blood pressure. But because of that, veins are also given to popping occasionally, okay? And if you get a varicose vein or something like that, that's what's happened, okay? The vein has ruptured and the blood has leaked out and clotted and that vein is occluded now and it's not going to be useful for anything anymore. Usually it only happens in superficial veins, so it doesn't cause much of a problem, it just looks ugly. But if that happens in a deeper, larger vein, that can actually cause edema in the area and prevent blood flow. So there's a difference between a harmful varicose vein and a harmless varicose vein. Also, as we age, if we have high blood pressure, the veins become less compliant. And so that also drives up your blood pressure. As we'll talk about in a minute, the veins being compliant is important because they got to draw the blood back in after it goes through the capillary beds. And not so much the blood, but the fluid called plasma. They can't be at a high pressure to do that effectively. If they're at a high pressure, they'll resist the vein flow and that causes swelling. And it's also the compliant nature of veins that allow them to be a repository for all that blood. Right? 60% of your blood is sitting in the veins. That's because they're compliant. If they weren't compliant, you couldn't have that big reservoir. We couldn't have that venous return bolus go back, and we wouldn't be able to adjust preload. So this compliancy issue is directly tied to that ability to increase venous return in Starling's law. That makes sense? All right. Okay, then we're going to get into this flow idea. Okay, blood flow, factors that affect blood flow. That's the next major thing to talk about. Well, blood flow is also, we can call it cardiac output. Cardiac output, we said that's minute volume. You take your stroke volume times your heart rate. Typical stroke volume was around 70 mils, multiply that by a heart rate of 70 beats per minute, and you got about 5 liters a minute as your cardiac output. Then we got to keep that flowing around the body while the heart relaxes. So now we're going to talk about the factors that affect that flow, called peripheral circulation or peripheral flow. Things flow, and you guys have told me this a couple times, things flow because of a difference in what? Pressure. Okay, so the main driver here is going to be pressure differences. Right. And our master flow equation, I saw it somewhere. There we go. Flow equals a pressure differential divided by peripheral resistance. This is called Poiseuille's law. And I think I can spell that. There's another I in there somewhere. I think that's it. Somebody want to Google that? I always struggle with where that other I goes. It's a French word. Poiseuille's law. What's that? Okay, thanks. Let me know if I spelled it wrong. I think that's right. Now, I've had 2 native French speakers in my class over the years who told me how you actually pronounce this word. You want to know how it's pronounced? Because I told her, I said, the one girl, I said, I don't think I can say that in class. Did I spell it right? Yeah. Okay, all right. So I say Poiseuille's law, but it sounds a little bit more like another name for a cat, okay? And I said, I can't say that. So Poiseuille's law is the master flow equation, okay? And it says a difference in pressure divided by peripheral resistance. That's what determines flow, okay? The triangle there means difference. So where's the high pressure point in your whole cardiovascular system? I've asked you this question before. Heart, specifically left ventricle, okay? And lowest pressure point in the whole cardiovascular system? Also the heart, specifically right atrium, okay? So that's your circuit, high pressure to low pressure. That's where the blood gets back to where it started from. Now, what's in between that? What comes between the left ventricle and the right atrium? No, the pulmonary circuit's not between those two. What's between the left ventricle and the right atrium?
Interventricular septum.
All right, yes. True enough, the interventricular septum. I mean from a flow standpoint. Oh, this shouldn't be a hard question. No. All right, guys. Don't answer. Think before you answer. What comes between the left ventricle and the right atrium? The whole systematic circulation. There you go. There you go. The whole body. Okay, the whole body comes between those 2 points. And that means we got lots and lots of capillary beds between those 2 points. Okay. So presumably we're going to get to an organ and come back from an organ. So here's the point: that while that's the high and the low, the heart, we have to have highs and lows in between also. So in order to get blood to flow to, say, the gastrocnemius muscle, okay, the blood pressure in the artery side capillaries of that muscle must be lower than it is in the ventricle. But to get it to go to the venous side, it's got to be lower still. But then there's still got to be some pressure there to get that to come back to the heart. And so we're going to talk about those intermediate pressures. And then opposing this the whole while, that's not the whole story. The difference in pressure isn't the whole story. We have this guy here, R. R, and R stands for resistance, okay? Resistance is anything that impedes flow. It's a pretty simple definition. Resistance is anything that impedes flow, okay? Now we've all seen water flowing through a stream or through a pipe or something like that. Maybe we're not experts in blood, but you've probably seen air flowing, and I'm sure you've seen water flowing. What are some things that can slow down the flow? What's that? Plaque? I'll agree. But can you explain why? That's why I was using the example of a stream or something like that. You're not wrong. Yeah, plaque can certainly impede flow. No, it's fine. That's okay. What kind of factors can impede flow just generally? What's that? Constriction? Blockage, okay, yeah, right. So that's what a plaque would be, right. Yeah, you put a dam across the stream, it's gonna slow it down, it's gonna cause a backup. That's one of them, definitely. Anything else? That's the major one. Changing the diameter of whatever we're flowing through. There are 3 other things.
A valve.
Well, that's a blockage. That's a type of blockage.
The viscosity.
There you go. The consistency of what's flowing, the thickness of what's flowing. That's called viscosity. Absolutely, right? Honey does not flow as quickly as water, okay? Because they're different viscosities. Okay, that's 2. What's that?
Volume.
The volume affecting flow. Well, okay. Secondarily, because volume's going to change this. Volume's going to change pressure. Yeah. Well, the next one I probably wouldn't expect you to get without some thought. The distance over which it has to flow. Okay, the distance, the length of the vessel. If I only have to flow from here to here, all things being equal, that's going to be a lot more rapid than flowing from here